Hi, I'm Dr. Pat Dougherty from Chiropractic Lifecenter here in Spokane on 2110 North Washington Street. And what I'm going to do today is demonstrate for you the use of cold laser to help with a chiropractic treatment. We'll start by showing how there is restricted motion in the patient. When I lift her arm up and she doesn't help me, we get stuck right about here on this side. And on this side, I get to about there and then she gets stuck. If she helped me, she'd go all the way up, but since she's not helping, I can tell she's restricted. Now that usually comes from the brain or the spine. So what I'm going to show you now is using cold lasers. I have two different kinds here. Cold lasers to make her loosen up so that her arms will move easier. Let's try this one first. One of the things I can do is I can find an area on her spine that helps her raise up. That doesn't really help. If I push on a specific area, there it does. So I know this area of her spine is helping to bind up her shoulders and her arms. So I'm just going to put a laser in there. And because the side we're working on is this side, I'm going to do a particular part of her brain also. And this doesn't really take very long. That's probably more than enough on the spine, not enough on the brain. And actually I'm going to do this side too over here. Okay, just that little bit of laser and relax and don't help me again. It helps her get up to about there. Okay, that means there's probably some other things going on. We'll see if it helped on this side. Yeah, that side's all loosened up now, which will tell me that this is the side of the body that needs more work. So I'm just going to lift here again, and this time when I lift, I'm going to push into the neck. Yeah, her neck needs a little laser still. So we're going to put this laser back on the neck area. We've already done the brain. The reason this works is because when you use laser, you're still stimulating cellular activity. The cellular activity will tell muscles, it'll tell joints to let go of the restriction, the tightness in those joints, and allow for normal free motion. Let's see, relax again. And now we're almost all the way up. She's still sticking when we get up to about here. That means there's probably a restriction up a little higher. I'm going to do a muscle test on her. Can you push up here, please, Jill? Mm-hmm. Push up. You okay doing that? No pain?
Yeah.
Okay, I want you to look straight ahead and push up again. And push up again. Push up now. Or now. Push up now. And push up now. Bite down. Push up. Open wide. Push up. So I'm going to, when she opened her mouth wide, she went weak. The receptors for the nerves in the jaw affect what happens in the spine up here. And since she still didn't have completely free range of motion, I'm going to laser her jaw to affect the tightness that's coming from her neck still. And now she's totally loose. So that was just a demonstration of how laser can help. Laser can be used to increase range of motion. It can be help get rid of pain by getting rid of inflammation or decreasing inflammation. It can help sluggish digestive system start working better. It can help any of the organs and glands because you can stimulate any of the organs or the glands in the body. You can stimulate any muscle. You can stimulate the brain. We can help people who just had a concussion or gotten a whiplash accident in a car. We can help them get rid of that fogginess, the memory problems, those kind of things, because those are all related to what happens in the spine. And so the laser is a good way to add to what you do when you adjust a patient.